During my 11 years of creating regenerative procedures and regenerative agents, I've had the opportunity to try to put together many concepts that cause the best chance or the best opportunity for patients to heal. And one day I was sitting and I put these ideas down on paper, and I ended up creating an acronym that I call the healing paradigm. The H stands for hierarchy. At what order do we need to address things in? It's kind of an understanding of how to not put the cart before the horse, how to not do procedures or approaches that come out of order. What I found over time is dealing with a person's motion, their stability, their strength, and while we're dealing with their chemical environment of their body is actually more important than doing a regenerative injection. Now, it's more difficult, it takes more time, it's more patient-centered, but it's ultimately the best thing that we can do for a person to return to what they want to do and have the best long-term outcome. The E in healing stands for environmental niche. The environment being the environment of our entire body, but also the environment of the area that is painful to the patient. This is determined largely by the immune system function, the neurologic function of the body, the endocrine or hormonal function of the body, whether or not that patient smokes, and medications or supplements that they're taking. It boils down really to one of the catchphrases that's out there right now, which is cellular health. And cellular health ultimately determines chemical niche of all of the areas that we may be working on in the body, which is a reflection of total body health. And in my opinion, you can't do regenerative medicine without doing chemical niche optimization. So I work with functional medicine providers and dietitians to optimize immune system function, endocrine or hormonal function, supplements, all the way down to exactly which supplements are inside of each person's cells and which nutrients they need to have more of, but also figuring out why they're not getting those nutrients there. That might be genetic, it might be their gut. There are many reasons, but figuring those out with individuals that are highly, highly trained in functional medicine is very important. Long term, how you feel, your general health and wellness, and how your condition that you came in to see me for is going to respond the best, the longest, if we deal with your environment and the niche of your whole body, as well as where we are working. The A in the healing paradigm stands for alignment, which is my way to speak to physical therapy and chiropractic, motion, and how your body is aligning, how your body's recruiting musculature to hold you, move you, stabilize you, and get you from point A to point B, be that walking down the steps or climbing Mount Everest. The body needs to be able to function in its appropriate coordinated way, and having highly trained and successful physical therapists and chiropractors who know what a regenerative approach means is very critical to that approach and that long-term outcome. Individuals are actually seen before and after a regenerative procedure with me, so that those individuals can help me understand what I need to do procedurally, and then long-term they're working with me to understand what we might need to do to fine-tune some of these structural elements of a person's problem, either via alignment and neuromuscular re-education through physical therapy and chiropractic, or through further regenerative injections. The L in the healing paradigm is an uncommon one. I put it in there very specifically because of some populations of patients that I work with. It stands for local bacterial infiltration. Our immune system is a very elegant system, mostly contained within our gut, which is why the dietary part of the chemical niche is extremely important. And when the immune system is working very well, it's clearing pathogens constantly that are getting into our blood, that come into our blood from many different places. The condition that is probably most concerned, that has the most concern around local bacterial infiltration is Lyme disease. It's at least the most commonly known one. However, there are viruses and many other types of bacteria that can actually infiltrate into tissues and cause deterioration via long-term irritation and deterioration. Even discs in the back have been shown to have chronic long-term infiltration of bacteria as being one of the reasons why these discs deteriorate. So understanding that there is a pathogenic component that needs to be addressed and understood as part of a regenerative paradigm is very important. The I in the healing paradigm is a very important one, and often near and dear to why somebody came and see me in the first place, which is injury. And this can be injury to a physical part of the body, oftentimes very remote from the time that the person saw me. For instance, if they had an ACL tear when they were in high school, that ACL tear, even if it was reconstructed, may not have been in perfect alignment, or the injury that occurred as part of the ACL tear to the knee may have been significant enough that, on average, 12 years after an ACL tear, there's radiographic or X-ray evidence of arthritis that's starting to form. And when you're dealing with that, sometimes in your early 30s, and people are starting to mention words like total knee replacement, that starts to get a little scary. So understanding where the original injuries came from, how they were dealt with, how they were reconstructed, how they were dealt with from a physical therapy standpoint, or even now we can start even considering that they may have had regenerative injections. Understanding the whole changes that may have happened to the neurologic system, motion, strength, stability because of these injuries is an important piece of understanding and assessing a patient. The other part of injuries that I like to bring up to people is those that happen to the mind and to the heart. When individuals are carrying around a great deal of anxiety, depression, they've been harmed very deeply, those individuals oftentimes have physical components of their emotional injury. And part of my genesis of becoming a healing regenerative physician has been to address that with people. I have psychologists and other energetic healers, very, very naturally talented individuals at healing people that are able to deal with those types of injuries with people. And I want to have a chance for everybody to have that addressed. I think too often in medicine, people just don't have the opportunity because it's never open to them to have their deep emotional pains dealt with. One of my friends was once the head doc for the Navy SEALs, and he had developed an injection that helps deal with PTSD via an injection. I use this very liberally with patients who want to deal with that very deep emotional aspect of their pain. What comes from the mind and heart often affects the body. The N in healing paradigm is sometimes, actually oftentimes, the most important piece of healing, and that's neurologic. Our neurologic system, from our brain to our spinal cord to the nerve roots coming out of our spine to all of the peripheral nerves, control everything in our bodies. I like to say that the chiropractors were ahead of allopathic medicine in understanding that what's coming from the spine is extremely critical to what's happening to the rest of the body. And if somebody has, for instance, knee arthritis and back pain at the same time, 100% of the time that back pain is involved in what's happening with that knee. Either because the muscles are not working well because the nerves aren't allowing them to, or because the nerves themselves may be dysfunctional from being compressed or impinged upon at the back. And things do not heal well if neurologic function is not working well. One very special part of neurologic function that I've spent a great deal of time on, which is probably associated with every injury that an individual has sometime in their life, will affect your ability to have appropriate range of motion, neuromuscular function, recruitment patterns in your musculature. All of these things are oftentimes dictated by the sympathetic or fight or flight nervous system. I've worked on a condition called complex regional pain syndrome for about the last 8 years, working on 6 different levels of the neurologic system all at once with biologic regenerative agents. That work has led into me understanding that almost every condition I work on has an abnormal sympathetic component, and I have developed new and often unknown ways of being able to heal that sympathetic nervous system, both through what I do combined with acupuncture and energy healing. So it becomes very fine and detailed to look at all of these 6 levels of the neurologic system as part of a condition that patient comes in with. And if these things aren't being addressed, oftentimes the patient can't heal. The G, by serendipity, I think, ended up being the last thing on the list, which is usually the first thing on everybody else's list, which is grade of defect. How bad is your condition? This is traditionally when you walk into an orthopedic surgeon's office, he'll throw your x-ray up and show to you, okay, you have the knee of an 80-year-old, and you have bone-on-bone arthritis. We need to do a total joint replacement on you. That is often the last thing that I consider with patients. All of those other things that I mentioned first, the hierarchy, the environmental niche, the alignment and neuromuscular patterning, the abnormal bacterial infiltration, the injuries, the neurologic function are all brought into perspective for that patient and how it affects their healing before I look at the grade or the severity of their condition. And it's very common in my hour and a half to 2 hours in my first appointment that I spend with patients that they start to ask me, well, is my knee bad enough that it's not healable anymore? Am I a candidate? And I can't do that. I can't rate somebody or give them an idea whether or not they're a candidate for a procedure based just on imaging. This is why I'm personally highly biased that certain types of practitioners are probably not very well fit for doing regenerative injections because their expertise is only understanding images. To understand all of the other assessment that goes into a healing paradigm is not well known to them. And I will admit I'm biased. I've done this for 11 years, and it's an extension of my calling in life to understand all of those pieces. That's how seriously I take what I do. But I like that grade of defect and how severe your condition is to be the last thing that we talk about. I was part of a study from 2010 to 2013 on knees, and those knees that were rendered or believed to be total knee replacement candidates, 94% of those individuals did not go on to total knee replacement 2 years after the procedures that we were doing at that time. Mind you, that was 7 to 9 years ago, and the technology has changed greatly since then. So if people were doing that well back then, yes, they're doing even better now with more understanding, more coordinated efforts, better regenerative agents, better methods of delivery. So even back then, there was significant evidence to suggest that what we are doing with biologic regenerative medicine is very effective. And so when I talk to a patient about grade of defect, I can, for every single part of the body, talk about this severity needs this approach with this physical therapy, with this chiropractic, with this amount of time in between each of those pieces, and sometimes more than one type of procedure in order to get from point A to point B. And elucidating that plan for the patient in a coherent way only comes because I've done tens of thousands of injections on patients. And all of that experience boils down to, how can I help you heal your body and live your best?